The 2025 Medicare Trustees report is released. Democrats call for investigations into recent changes at a vaccine advisory panel. And final details of the Republican budget reconciliation bill are made public. For the week of June 23rd, 2025, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
We have received, as you know, from the House, budget reconciliation bill. The Senate now, Finance Committee, has completed its portion of it, and it was released, the text was last night. We believe it leads to a stronger and more prosperous America. And so we are
kicking off this week's episode with news from Capitol Hill, where the Senate Finance Committee unveiled its portion of the GOP's budget reconciliation bill last week. Release of the bill language follows lengthy, closed-door negotiations among Senate Republicans about what revisions to make to the One Big Beautiful Bill Act, passed by the House of Representatives on May 22nd. House leadership had urged senators to limit changes to the legislation, given the narrow margin by which the bill was passed in a 215 to 214 vote. The Senate package goes farther than the House bill in limiting states' abilities to use medical provider taxes to help fund their share of the Medicaid program. The House proposed to set a moratorium on new or increased provider taxes, while the Senate's version would gradually reduce the amount that Medicaid expansion states can tax their health care providers from the current 6% of net patient revenues to 3.5% in fiscal year 2031. The tax rates of non-expansion states would be frozen at their current level. Senator Josh Hawley, a Republican from Missouri, amongst others, has been outspoken in his concerns about the impact of these provisions on rural hospitals. Senate Republicans are reportedly working to draft language that would create a special relief fund for rural hospitals in response to such concerns. The Senate bill's provisions around Medicaid work requirements also diverge from the House-passed version. The Senate would subject parents with children aged 15 and older to work or community service requirements, while the House plan would exempt all people with dependents from proposed work requirements. The Senate bill omits most of the House-passed policies related to pharmacy benefit manager industry reform, as well as the Medicare physician reimbursement provision. It also drops a proposal to expand the Medicare drug price negotiation program's exemption for orphan drugs to include treatments for multiple rare diseases. The package does not include reforms to the Medicare or Medicare Advantage program, an idea which was under discussion by Senate Republicans earlier this month. The Senate reconciliation package would raise the debt ceiling by $5 trillion compared to the $4 trillion contained in the House-passed measure. The Treasury Department has projected that the nation could hit its borrowing limit as early as mid-August, posing the risk of a U.S. default on its payment obligations at that time. In addition to the ongoing negotiations around the impact of the bill on financially vulnerable hospitals, Republicans also still lack agreement on several other issues in the broader legislation, including the debt ceiling, the SALT cap, and clean energy tax breaks. The reconciliation provisions are also being reviewed by the Senate parliamentarian to ensure they meet the chamber's budgetary rules, with the Finance Committee provisions being adjudicated on Sunday. The Senate Republican Conference aims to pass the reconciliation package this week and send it back to the House for final approval prior to the July 4th recess. Republicans can only lose 3 votes in either chamber and still pass the bill along party lines. House Energy and Commerce Committee Ranking Member Frank Pallone, a Democrat from New Jersey, is requesting that Chairman Brett Guthrie, a Republican from Kentucky, open an investigation into recent changes made at the Advisory Committee on Immunization Practices, or ACIP, by the U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr. The Secretary fired all 17 members of ACIP earlier this month, after making a unilateral decision to change COVID-19 vaccine recommendations for pregnant women and children. Pallone's letter reads, quote, "Not only do these actions break promises he made under oath during his Senate confirmation, but they appear to be further proof that he intends to use his position as HHS Secretary to continue to advance his dangerous pseudoscience agenda," unquote. Senate Health, Education, Labor, and Pensions, or HELP Committee ranking member Bernie Sanders, an independent from Vermont who caucuses with Senate Democrats, sent a similar letter to HELP Committee Chair Bill Cassidy, a Republican physician from Louisiana, earlier this month, arguing that RFK Jr.'s quote-unquote reckless decision to fire ACIP members and, quote, replace them with ideologues with limited expertise and a history of undermining vaccines will not only endanger the lives of Americans of all ages, it directly contradicts a commitment he made to you before he was confirmed that he would not make any significant changes to this important committee, unquote. ACIP is next scheduled to meet on Wednesday and Thursday of this week. The Secretary is scheduled to appear before the Energy and Commerce Health Subcommittee to testify about the proposed HHS budget for fiscal year 2026 on Tuesday. Final news today, where the Department of the Treasury released the annual Social Security and Medicare Trustees reports on Wednesday. As in prior years, the trustees found that the Medicare program continues to face significant financing issues. This year's report projects that the Hospital Insurance Trust Fund will be able to pay 100% of total scheduled benefits until 2033, 3 years earlier than reported last year. At that point, the fund's reserves will become depleted, and continuing program income will be sufficient to pay 89% of total scheduled benefits. While the Supplementary Medical Insurance Trust Fund is adequately financed into the indefinite future, because its main financing sources, beneficiary premiums and federal contributions, are automatically adjusted each year, the trustees note that the fund's costs are rapidly rising and place increasing demands on beneficiaries and general taxpayers. We end each week's episode with the call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Tuesday, June 24th at 10 a.m., the House Energy and Commerce Subcommittee on Health holds the hearing, the fiscal year 2026 Department of Health and Human Services budget. Second, on Wednesday, June 25th at 9 a.m., the House Ways and Means Subcommittee on Health convenes a hearing titled Health at Your Fingertips, Harnessing the Power of Digital Health Data. Third, on Wednesday, June 25th at 10 a.m., the Senate Health, Education, Labor, and Pensions, or HELP Committee, gavels in a hearing on the nomination of Susan Monarez to be the director of the Centers for Disease Control and Prevention. Fourth, on Wednesday, June 25th at 10 a.m., the House Oversight and Government Reform Subcommittee on Healthcare and Financial Services hosts the hearing, Sacrificing Excellence for Ideology, the Real Cost of DEI. Fifth, on Wednesday, June 25th at 3:30 p.m., the Senate Special Committee on Aging holds a hearing entitled Lessons from the Field, How Sports Medicine Can Improve Health Outcomes for Seniors. Sixth, on Monday, July 21st at 5 p.m., the House Appropriations Subcommittee on Labor, Health and Human Services, Education, and Related Agencies hosts a markup of their fiscal year 2026 legislation. And last, on Thursday, July 24th at 10 a.m., the full House Appropriations Committee convenes a markup of fiscal year 2026 Labor, Health and Human Services, Education, and Related Agencies legislation. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.